Welcome. Today we're delving into a complex and often misunderstood disease of primary sclerosing cholangitis, or PSC. This is a chronic, progressive disease affecting the bile ducts inside and outside the liver. Join us as we explore its causes, symptoms, diagnosis, and management. Unfortunately, the exact cause of PSC remains a mystery. Researchers believe it's likely a combination of genetic predisposition and environmental factors. One leading theory suggests an autoimmune component, where the body's immune system mistakenly attacks the bile ducts. Notably, PSC is strongly associated with inflammatory bowel disease, particularly ulcerative colitis, suggesting a shared or related underlying mechanism. Specific genes, particularly those involved in immune function, are being investigated as potential contributors. Let's understand what happens in the body with PSC. The disease primarily attacks the bile ducts, leading to inflammation and scarring. This scarring, known as fibrosis, gradually narrows the ducts, causing them to become blocked and stiff. The obstructed bile flow damages the liver cells, leading to inflammation of the liver, cirrhosis, and eventually, liver failure. Think of it like a plumbing system getting clogged, eventually backing up and causing damage upstream. PSC is a relatively rare disease. While it can occur in people of all ages, it's most commonly diagnosed in men between the ages of 30 and 50. The prevalence, or the number of people living with PSC at any given time, varies depending on the geographic location. Due to its association with inflammatory bowel disease, individuals with conditions like ulcerative colitis are at a higher risk of developing PSC. The symptoms of PSC can be quite variable and sometimes subtle, especially in the early stages. Many individuals are asymptomatic for years. As the disease progresses, symptoms may include fatigue, itching, jaundice, a yellowing of the skin and eyes, abdominal pain, and fever. Repeated infections of the bile ducts known as cholangitis can also occur. In advanced stages, complications of cirrhosis, such as ascites, a fluid buildup in the abdomen, and variceal bleeding, may develop. Diagnosing PSC typically involves a combination of blood tests and imaging studies. Liver function tests can reveal elevated liver enzymes, indicating liver damage. However, the gold standard for diagnosis is a cholangiogram, which is an imaging test of the bile ducts. This can be performed via an ERCP or endoscopic retrograde cholangiopancreatography, or by MRCP, magnetic resonance cholangiopancreatography. MRCP is non-invasive and becoming increasingly preferred. These imaging techniques allow doctors to visualize the bile ducts and identify the characteristic beating and narrowing associated with PSC. While there aren't distinct types of PSC in the traditional sense, the disease can be categorized based on the location of the affected bile ducts. Large duct PSC involves the larger bile ducts inside and outside the liver, which is the most common presentation. Small duct PSC affects only the small bile ducts within the liver, which can be more challenging to diagnose because it might not be visible on traditional cholangiograms. However, both forms ultimately lead to similar liver damage and complications. Unfortunately, there is currently no cure for PSC. Treatment focuses on managing the symptoms, slowing the progression of the disease, and preventing complications. Medications like ursodeoxycholic acid, or UDCA, are often prescribed to improve bile flow and potentially slow down liver damage, though its effectiveness remains debated. Antibiotics are used to treat bacterial infections of the bile ducts. Cholestyramine can help alleviate itching. Ultimately, for many patients with advanced PSC, liver transplantation is the only life-saving option. As the exact cause of PSC is unknown, there are no definitive preventative measures. However, maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial for overall liver health. Individuals with inflammatory bowel disease should work closely with their healthcare providers to manage their condition, as this may indirectly help reduce the risk of developing PSC. The prognosis of PSC varies widely among individuals. Some people may experience slow disease progression over many years, while others progress more rapidly to liver failure. On average, the time from diagnosis to liver transplantation or death is around 10 to 15 years. Recent research is focused on identifying biomarkers to predict disease progression, developing new therapies to slow or halt the disease, and improving outcomes after liver transplantation. Investigational drugs targeting specific inflammatory pathways and immune responses are also under development, offering hope for future treatments.